Very fortunately, um, the mini lungs that we had, as I think I mentioned before, not only have the lung cell types, but also have the other cell types that constitute a real human lung. And we've made sure that the mini lungs can also have cell types called macrophages. These are the mediators of inflammation, which some people believe really is what is killing the patients. They also have blood vessels in them, um, and many people believe that it's the leakiness of the blood vessels in the lung that is also contributing to the pathology in the patients. And also, very, very interestingly, and this gets back to what we as neonatologists do all the time, these organoids have cell types called type 2 alveolar cells. Now, we as neonatologists know this because these are the cell types that make kind of a molecule called surfactant. Surfactant is what makes the air sacs very, very flexible. A neonatologist knows about this because they don't develop until 34 weeks of age, and we deal with lots of babies that are born before 34 weeks gestation and age, and we have figured out how to either replace surfactant or watch the development of these kind of cell types. What many of the patients with COVID-19 are dying from is something called adult respiratory distress syndrome. It's what we all the time see as neonatologists, but now happening in an adult. Now, it's either because the virus is directly attacking those cells that make it, or the stress of the environment or the inflammation is just using up all of the surfactant. Either way, one, we can answer that question of what's going on, and two, screen for drugs that particularly are addressing this surfactant deficiency, either drugs that can prevent it from being used up, or that can stimulate its production, or that can protect the alveolar cells. So I think that particularly focusing on drugs that are downstream of the viral infection. Certainly we're going to look at how we can block what the virus does directly on the cells, but to answer your question, what can we do for those that have already been infected with the virus? Well, we can find the right anti-inflammatory drug because we have macrophages there. We can look at what is going on with the blood vessels. Maybe we can stabilize them. There's also a thinking that a lot of what is going on is that the coagulation pathway is put into hyperdrive. We're getting blood clots where we shouldn't. I think we may be able to start address that because we have blood vessels in there. And then finally, we can try to figure out, after the virus has attacked these various lung cells, can we figure out how to reverse that process, how to protect these lung cells? And again, what many people think stem cell biologists do is trigger repair, trigger regeneration. Well, we can look at that. That actually is right in our sweet spot.